number of COVID-19 cases continues to rise globally and right here in Guyana. Therefore, we encourage everyone to practice social distancing. Wear a mask if you have to leave your homes, and wash your hands thoroughly and frequently as we strive to stop the spread of the virus. Welcome to InfoHub for Thursday, May 28th. Thanks for joining us. His Excellency President David Granger told a high-level UN forum that given the multidimensional nature of the impact of COVID-19, extraordinary financing must be directed to support small states and recommended ways in which this can be done. Hear more in our first report. This was expressed during his presentation on Thursday during the United Nations high-level meeting organized to tackle critical finance issues and address economic devastation caused by COVID-19. President Granger told participants of the meeting that support to small nations can be done in three ways.
Respond immediately to the life-saving exigencies of the pandemic. Second, to develop holistic, long-term recovery plans and exit strategies. And third, to build capacity to establish permanent public health structures to prepare for future international diseases, such as we've seen over the last decade.
He further emphasized that long and short-term solutions are needed to save lives and support livelihoods.
In the medium and long terms, we must build capacity to respond effectively and efficiently when faced with health crises which are predicted to occur more frequently in the future. In the long term, we must achieve food security by sustaining agriculture, manufacturing, and services, so that when our economy reopens, our public and private sectors will be capable of rapid production and progress. In the short term, however, we are obliged to respond to the urgent, unavoidable, and unanticipated effects of COVID-19. The public health sectors require costly and necessary assets.
The head of state commended the governments and institutions which have supported the flow of much-needed resources to small states and emphasized that more must be done. The Batara-Sebruni is one of the three remaining regions free of any COVID-19 cases. In this report, the regional health officer tells us what the region has been doing to safeguard its residents against the virus.
Since Brazil has been deemed the epicenter for transmission of the virus in South America, Region 8 officials, including the Health Department, have stepped up efforts to protect residents in the region. Regional Health Officer Dr. Cassandra Abdul on Wednesday shared what has been done thus far in the region with regards to keeping it COVID-19 free.
We've also conducted risk assessments, especially in the North Pacaramas, engaging not only the health workers, but the two shows, and also other members of the communities so that they can better understand the importance of their role in helping us fight against COVID-19.
Meanwhile, in other parts of the region, checkpoints for screening have been set up in various areas.
A checkpoint has also been established at Sibali Landing, where commuters are screened just before crossing into Madhya. There is also another screening area just as you enter the Madhya District Hospital and at our airline service providers.
The region has been ensuring that information regarding COVID-19 is being efficiently disseminated through posters, flyers, social media, and Radio Madhya. A regional hotline has been set up so that persons can call for more information and have questions answered. That number is 608-7517. For InfoHub, Delicia Haynes.
A four-phase plan for the reopening of the country's airports, which were closed amid the COVID-19 pandemic, has been drafted by the Guyana Civil Aviation Authority and is subjected to review by the National COVID-19 Task Force. Shaquille Bourne has the details.
According to GCAA's Director General, Lieutenant Colonel Egbert Field, Phase 1 of the blueprint is regarded as the planning stage. This phase will see the continuation of the airport's closure to international travel while allowing repatriation and cargo flights. Standard operating procedures, SOPs, to safeguard health, safety, and security will also be drafted through multi-stakeholder meetings during the first phase. Phase 2 is dubbed the implementation phase, and it entails the resumption of regional travel, along with constant review of the SOPs and consultations with stakeholders.
our third phase is really now expanding some more, taking in foreign nationals, and this phase runs right through to like between August and December.
GCAA's Director General, Lieutenant Colonel Egbert Field. Phase 4 will see an extension of the airport's reopening into 2021, with a possible resumption to normalcy in the aviation sector. The GCAA head stressed the importance of monitoring the evolving pandemic in regions of the world where flights to Guyana may originate. This, he said, may affect the timeline Guyana sets for reopening its airports. Shaquille Bourne for InfoHub.
APNUFC's counting agent Aubrey Norton says PPP agent Anil Nandlal needs to get his facts right on the matter of obtaining death certificates. Alexis Rodney has that story.
Nandlal and the PPP have been contending that any person who obtains a death certificate without the deceased family's consent has committed an offense. The party's General Secretary Bart Jagdeo has even threatened that anyone who goes through with such will face the brunt of the law. But APNU AFC's accounting agent Aubrey Norton, citing Section 42 of the Registration of Birth and Death Act, said Wednesday that the law itself makes provision for accessing the certificates.
The Registrar General shall cause indices of all duly completed registration forms in his possession herein mentioned to be made and kept in the General Registrar Office. It goes on. Everyone shall be entitled on payment of the fee prescribed by the Minister by order to search the indices between the hours of 10 o'clock in the morning and 4 o'clock in the afternoon of every day, except public holidays and Saturday, and to have extracted therefrom a sealed certificate of birth in Form 4 or a sealed certificate of death in Form 5.
Norton said the law clearly allows for any individual to search the records and procure a death certificate once the required fee is paid. Objections of the names of dead persons being used to vote at the march to polls continue to be raised during the ongoing national recount. Guyana Elections Commission's Chair Justice retired Claudette Singh said evidence of these incidents, along with cases of out-of-jurisdiction voting, can inform the Commission's deliberation on the recount. Norton said the party's investigation has showed that over 90,707 votes have been affected by the opposition's attempts at fraud. For InfoHub, Alexis Rodney.
Stay with us. More news after this break.
Meet Terence and Shabana. Both believe they've been exposed to COVID-19 and were advised by the Ministry of Public Health to quarantine themselves at home. It's a normal working day and Terence grows tired of home quarantine guidelines. So he heads off to work using public transportation. Now all the passengers and his co-workers are in danger of contracting COVID-19 from Terence. After work, Terence heads straight to the gym for daily exercise. He shares the same exercise equipment with many others that day. Later on that evening too, Terence heads off to play several rounds of dominoes with some friends. By breaking the quarantine rules, Terence has endangered the lives of the passengers, his co-workers, members of his gym, and his friends with whom he played dominoes. By contrast, Shabana practices social distancing. She works from home every day, and in the evenings, she video chats with her family and friends to stay connected. Shabana is also obeying all the guidelines that the Ministry of Public Health says we follow when quarantined at home. Shabana has infected no one. Let's all do our part and practice physical and social distancing by avoiding unnecessary travels and staying home from large groups of people, including our families and friends. A message from the Ministry of Public Health in collaboration with PAHO WHO. For more information, visit our website at www.health.gov.gy or visit our Facebook, Instagram, or Twitter page.
Welcome back. Leading by example, the Rural Affairs Secretariat of the Ministry of Agriculture started its own kitchen garden as part of the ministry's COVID-19 Relief Kitchen Garden initiative. Here's more.
We at the Ministry of Agriculture, the Rural Affairs Secretariat, we have started our kitchen garden initiative.
That was the Honorable Valerie Adams Yearwood, the minister within the Ministry of Agriculture with responsibility for rural affairs. She noted that the ministry's kitchen garden serves as a replicate for interested persons who have limited or no space in their backyards.
Persons who don't have space in their yard to make beds, they can buy these containers, or maybe they may have an old pot, an old pan, a tub, an old bucket, and they can use it and plant.
The Ministry of Agriculture continues to encourage everyone to join the COVID-19 Relief Kitchen Garden Initiative.
We are encouraging other ministries, we are encouraging churches, clubs, the schools to get on board, and they too can establish their garden plots. We really want persons to get on board with a kitchen garden.
The agricultural minister highlighted some benefits of getting started.
Set up your kitchen garden. Get your garden plot set up. And within 2-3 months, you can begin to benefit from this effort. You can begin to save money. You can begin to eat organic. And that's what we at the Ministry of Agriculture is encouraging.
For InfoHub, Gavin Lewis.
Moviegoers will soon be able to enjoy a diverse array of films, as the 5th Tamari Film Festival is scheduled to be broadcast from June 4 to 7, 2020. The festival is held by the Caribbean Film Academy in partnership with the Third Horizon.
This year, due to the COVID-19 pandemic, the films will be live streamed on the Tamari Film Festival Facebook page and its YouTube channel. It was noted that TFF will hold several private satellite screenings for audience that do not have access to these social media platforms. Among these are select schools, community groups, prisons, and indigenous communities. TFF's director Melissa Roberts told InfoHub that the festival will see over 26 films, including short features from the 592 48-hour film challenge, a collaborative effort between TFF and Bench Street Film LLC.
This year, though, we wanted it to stay indoors, so I think it's a harder challenge because people have to come up with ideas of how to create a movie indoors, and you just have to do it in 48 hours. We want you to experiment and just let the creative juices flow and see what we come up with. And of course, Guyana will get to see those films.
Roberts noted that over the years, the film festival have been free. However, this year, there will be a suggested donation, which is voluntary, and any amount is welcome.
We really want people to really participate. So go online, Facebook, hit up Facebook. If you're not a YouTube person, Guyanese right now is totally Facebook or Instagram or TikTok. But in this case, hit Facebook up to Tamari Film Festival. And like I said, I'll be airing it on my page. And just view, comment. We want to hear comments because it's only then the filmmakers will know if they're doing something right or wrong or if they're in the right direction.
The film festival began in 2015 as part of that year's independence celebrations and has been drawing positive reviews over the 4 years of its existence. Neola Damon, InfoHub.
Remember to do your part to ensure that you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical care early, but call the hotline first. That's all for today. Connect with us on all our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. Also, subscribe to our website, dpi.gov.gy. Your Bridge Report is up next. Goodbye for now.